Confused by all the medical codes, ICD, CPT, HCPCS? You're not alone. Every healthcare bill, insurance claim, and diagnosis depends on these three powerful code sets. But what do they mean, and how are they different? In just minutes, you'll master what most coders spend months figuring out. Stick around, because understanding these codes isn't just helpful, it's essential. ICD, Captain, and HCPCS codes form the foundation of medical coding in the United States. They are essential for documentation, billing, and reimbursement. Each coding system plays a distinct role in translating patient encounters into standardized data for insurers. ICD codes, International Classification of Diseases, are primarily used to document diagnoses. These alphanumeric codes describe a patient's condition or reason for the medical service. In the U.S., coders use ICD-10CM, maintained by the CDC. CPT codes, current procedural terminology, are 5-digit numeric codes maintained by the AMA. They represent medical, surgical, and diagnostic services provided by physicians. CPT codes are essential for billing healthcare services to payers. HCPCS codes, Healthcare Common Procedure Coding System, include everything not covered by Captain codes. These alphanumeric codes represent durable medical equipment, ambulance services, medications, and supplies, especially for Medicare and Medicaid. Think of ICD as why the patient is being treated, Captain as what is being done to the patient, and HCPCS as what else is used or provided during care. This triad ensures complete, accurate documentation and reimbursement. ICD-10CM codes are 3 to 7 characters long. For example, E11.9 represents type 2 diabetes without complications. Proper ICD coding ensures medical necessity is documented, which supports billing claims with accurate diagnostic reasoning. CPT codes cover a vast range of medical procedures, from office visits to complex surgeries. For example, 99,213 represents a standard 15-minute office visit. CPT codes help insurers understand the type and extent of services performed. HCPCS Level 2 codes start with a letter, AV, followed by 4 numbers, like A0429 for an ambulance service. These codes are often used with Medicare, Medicaid, and other government payers, especially when billing for supplies and equipment. ICD-10CM codes are updated annually by the CDC. CPT codes are revised each year by the AMA. HCPCS codes are maintained by CMS. Coders must stay updated with changes to avoid rejections and claim denials due to outdated codes. Medical necessity is a crucial concept in medical billing. The diagnosis, ICD, must support the procedure, Captain, HCPCS. Without a medically justified ICD code, even correctly coded procedures can be denied by insurers. CPT codes are divided into 3 categories. Category I, Mainstream Services, Category 2, Performance Tracking, and Category 3, Emerging Technologies. Most billable procedures fall under Category I. HCPCS Level 1 codes are essentially Captain codes, while Level 2 codes are unique to HCPCS. Level 2 covers things like prosthetics, orthotics, and home health services, filling gaps where Captain does not apply. Accurate coding is vital for insurance reimbursement, performance measurement, and health data tracking. Incorrect use of ICD, CPT, or HCPCS codes can lead to claim denials, payment delays, or audits. ICD codes are used across inpatient, outpatient, and provider settings. CPT codes are used mainly in outpatient and physician billing. HCPCS is used in both settings, especially for non-physician services. Let's take a real-world example. For a flu shot, the ICD code might be Z23, the Captain code for vaccine administration might be 90,471, and the HCPCS code for the vaccine product could be Q2039. Coding modifiers enhance CAPTAN and HCPCS codes by adding context. For example, modifier 25 indicates a significant, separate evaluation on the same day. Modifiers improve billing accuracy when multiple services are provided. Coders often rely on tools like Encoder Pro, HCPC Coder, and 3M to search and validate ICD, CAPTAN, and HCPCS codes. These tools reduce errors and provide access to official coding guidelines and payer policies. CPT codes are essential in calculating relative value units, RVUs, which influence physician reimbursement. RVUs consider the work, expense, and risk involved in delivering a healthcare service. HCPCS codes are critical when billing durable medical equipment, DME. These include walkers, crutches, oxygen tanks, and braces. Medicare uses HCPCS Level 2 extensively for these services. Every diagnosis and treatment must align correctly. For example, coding a CAPTAN code for an X-ray must be supported by an ICD code indicating trauma, like S92.001A, foot fracture, to pass insurer scrutiny. CPT codes were originally developed in 1966 to create a uniform language for medical procedures. Today, they're a central part of electronic health records, EHRs, and healthcare communication. HCPCS includes temporary codes like G codes and K codes. G codes are used for Medicare-specific services like wellness visits, while K codes cover temporary supplies until formal codes are approved. ICD codes also help in epidemiological tracking, identifying disease trends, and public health reporting. Global and national health organizations rely on ICD data for policy making and research. A solid grasp of CPT, HCPCS, and ICD is essential for passing coding certifications like CPC, CCS, or CCA. Exams focus on correct code assignment, guidelines, modifiers, and linkage between diagnoses and procedures. Coders must understand NCCI, National Correct Coding Initiative, edits, which define which CAPTAN, HCPCS code combinations are allowed. Ignoring these can lead to denials or reduced reimbursements. Each payer, Medicare, Medicaid, and private insurers, may have its own billing rules for CPT and HCPCS codes. Coders must check payer policies for coverage, bundling rules, and frequency limits. In inpatient hospital settings, coders use ICD-10PCS for procedure coding instead of CAPTAN. ICD-10PCS is a highly detailed system with over 87,000 unique codes, designed to describe procedures performed during hospital stays. Codes are structured based on 7 characters, representing the body system, route operation, approach, and devices used. This system ensures precise procedural documentation for complex inpatient care. CPT and HCPCS codes are essential in quality reporting programs like MIPS, Merit-Based Incentive Payment System. These codes directly impact a provider's performance score, which in turn affects reimbursement in value-based care models. Accurate use of CPT and HCPCS ensures proper tracking of outcomes, promotes compliance with regulatory standards, and helps healthcare organizations maintain eligibility for incentive payments. With the rapid growth of telemedicine and remote healthcare, CPT and HCPCS codesets have evolved to include virtual visits, remote patient monitoring, and digital assessments. Coders must be knowledgeable about specific codes and appropriate modifiers, like modifier 95 or GT, to indicate telehealth services. Correct coding ensures providers are reimbursed accurately and complies with payer-specific telehealth billing guidelines. In conclusion, ICD, CAPTAN, and HCPCS codes are vital for effective healthcare delivery. They ensure clinical services are accurately documented, justify reimbursement, and provide data for research and quality improvement. Mastery of these code sets is not just a technical requirement, it is essential for career success in medical coding, reducing denials, improving revenue cycle performance, and enhancing overall patient care documentation. ICD, CAPTAIN, and HCPCS codes are the three primary coding systems used in U.S. healthcare to document diagnoses, procedures, and services. ICD codes, currently ICD-10CM, identify a patient's medical condition and justify the need for care. CPT codes, maintained by the AMA, describe medical, surgical, and diagnostic procedures performed by healthcare providers. HCPCS codes, especially Level 2, cover services not included in CAPTAIN, such as medical equipment, supplies, and certain medications. While ICD is used in both inpatient and outpatient settings, ICD-10PCS is specific to inpatient procedures. CPT and HCPCS are essential for outpatient billing, quality reporting, and value-based care. With the growth of telehealth, new codes and modifiers have been introduced. Accurate coding ensures timely reimbursement, regulatory compliance, and quality care delivery. Mastery of these code sets is crucial for medical coders and healthcare organizations.